Greetings, everyone, and welcome to the Digital Dental Podcast. This is the monthly podcast where we sit down with digital dentistry insiders and industry professionals to talk about digital dentistry and how the digital revolution has impacted them, their practice, their patients, and their business. This is season 2 of the podcast, and I'm extremely excited to be starting it. As you might notice, if you're watching this on video, we're doing things a little bit different here for season 2. And that's all because season 2 is officially a production of Imagine USA, which I'm extremely excited about. Season 1 was all done by myself, just in my spare time. And believe it or not, even for a humble podcast, it does take quite a bit to prepare and produce, publish these things. So big shout out to my boss and Imagine CEO Felix Chung for offering to make the Digital Dental Podcast and Imagine production. But rest assured, we're always going to have the great content, great candid conversations, and great information for all of you listeners and viewers. So without any further ado, I'd like to introduce my guest for today, Georg Schilli, who is the CEO of probably the best German-Swiss implant manufacturer that maybe folks haven't heard of yet, but we're going to change that today, SIC Invent. So Georg, welcome to the podcast.
Neil, what a fantastic introduction. I love it. I always like to be the best.
There we go. We're having fun already, right?
It's not always working out, but here we are. And I'm very happy to be here.
Well, I'm really glad that you are.
Very, very happy to be part of this podcast. And yes, America is America. And I went to school in America for a couple of months in the late 80s, believe it or not, in Missouri. In St. Louis, Missouri, and I enjoyed it very much. So I know what real America feels like. And when I came back now to New Hampshire a couple of months ago, now it's the third time I'm coming in here to see you and the team, I enjoy the old America.
Yeah.
I enjoy parking free on the street, having all the restaurants around here, having wonderful people. Not only a wonderful team, but wonderful people here in the Northeast.
It's highly complimentary, and we really appreciate it. It's great to have you out. It really is. It's a real treat. So I thought that we could kind of start by introducing, our listeners to SIC Invent, right? So this is a company that's been around for 2 decades or more, has a rich history with the beginnings, which sort of involved, or at least were connected to, the famous Dr. Brånemark, who largely pioneered implantology. Can you kind of give us the short version of that history and help us understand where SIC Invent came from?
Neil, the short version. I try to make it as short as I can.
Do your best.
You just mentioned one name, Professor Brånemark, PI, Per Ingmar, very Swedish name. Probably the godfather of implantology.
You're right.
Yes, I have to, since you started with Professor Brånemark, I have to explain that we acquired the PI Brånemark company from Zimmer Biomed in 2016, I believe.
Okay.
And that's and the reason was really also because of the legacy of Professor Brånemark.
Yeah.
And it's a Brazilian company with production facility, their own lines called the PI implant line in Brazil, and it's probably going to be introduced to the US soon as well. We're probably going to do this together.
Yeah.
But this is not our topic today. Our topic today is SIC Invent. SIC is a company which was created by myself 22 years ago, and the name says it all. Basically, it's Schilli Implantology Circle.
Yeah.
And Schilli is my family name, and my father, I miss him a lot. He passed away 4 years ago. Was Professor Wilfried Schilli, and he is the godfather, one of the godfathers of craniomaxillofacial surgery.
Yeah.
And he was one of the first presidents of the AO. The AO is Allgemeine Gesellschaft für Osteosynthese, is a society which works out of Davos, which works very closely with the today's American company Synthes in developing solutions, craniomaxillofacial solutions. With the craniomaxillofacial solutions, you always get in touch with implants. And if we look into the history of dental implantology, one of the pioneers from the company side here, from the industry, is clearly the Swiss-German company Straumann.
Right.
And Straumann has, and that's why I'm doing this detour, Straumann has the ITI, the International Team for Implantology.
Right.
Also here, my father, Wilfried Schilli, was one of the first vice and later on presidents. And the similarities between the AO and the ITI were that they gathered people together to empower, basically. They got the experts on the table in order to develop the best products for the industry and after all for the patient.
Right.
This school of thought, this methodology, I thought we have to bring again. There's room for another implant system. We have to bring again to the market. And that's where we founded SIC Invent as a company, and the SIC, which is like the ITI, the Schilli Implantology Circle, advising us, giving us the feedback from the market in order to develop the right products. And that was done we started in 2003, and we launched the first product in 2005. And the vision and mission of the system, where we saw really the opportunity to be among the best, were that we said, no question, premium, it has to be premium, but it has to be simple.
Right.
Yeah. It has to be simple. And in those days, we only had a few implant shapes from the different premium players, the peers in the market. But simplicity was already then, somewhere leaving us. Yeah. And here we said, when we do a new system, when we attack this, it's not only about the quality and about the society and about the think tank, it's about the architecture of the system. And that's why today the SIC system is probably the most versatile, most efficient system in the market.
While still being simple.
Yeah.
That's a great kind of ethos and mindset to have when you're creating a company, right? Is to have kind of these core values that are, inherited and brought forward from your father to you, and informed by that Schilli Implantology Circle, right? And we'll talk more about the circle later, because I think it's a great concept that that many people will be really intrigued to hear how that works, But I want to talk more and kind of unpack that simplicity, right? So you said a moment ago, even in the earlier days of implantology, the industry and the companies and the process and the protocol was starting to get away from simplicity, right? And it was a priority of SIC Invent from the beginning to return to simplicity or bring about new simplicity. Can you help me understand, how was it getting away from simplicity, and how did you bring it back?
It went away from simplicity because we were challenged with more and more solutions we had to solve, or challenges we had to solve in the dental office, with the patient.
Yeah.
So from the simple implant systems didn't do the work anymore. So they had to be extended. The peers, the market leaders at these times, at those former times, instead of developing and doing something of their own, they acquired companies. They acquired companies in order to be able to deliver everything what's needed to the And that ended up in having 2, 3, 4, 5 different surgical kits. You have to educate on that, all of that. And that's something which already started when we started. And if you look at the SIC system, we're all very proud of that. And today the industry is really all going that direction. All of them are trying to do this, which is not easy because we started like this, is that everything we do was developed by ourselves. And if you develop things, you try to, of course, streamline those developments with already what you have.
Right.
So we built basically from one SIC ACE, the basic parallel walled implant system, which came to the market in 2005, which already then was platform switched, which already then in 2006 was fully guided, available.
Yeah.
We were one of the pioneers. We moved into the SIC Max for maxilla for softer bone. We went now into the trend for tapered implants, the SIC taper, and all that is controlled or is managed with that one tray. And it's all managed and done chair side with one drill line.
Wow.
So this is a huge advantage for the surgeon because if you go through diagnostics and you prepare your case, you do your digital planning, and then you sit with your patient, you very often find a completely different situation.
Right.
And then you say, hey, nurse, I need bring you that and that and that. Oh, damn, that's not ready now,
Right.
doc. So, it's there.
Yeah.
It's all there.
Yeah.
3 different implant shapes and ready to go. And then one internal connection, same size, simplicity, going down to the lab. And now with Imagine the Future, covering the digital workflow.
Yeah.
Awesome.
It's a great solution.
I'm super excited.
Yeah.
We are.
Yeah. Yeah. I think that's a great example of simplicity and ease, right? And how it makes the clinician's life better, right? It doesn't matter if you're placing, an SIC ACE, the parallel, the SIC taper, the tapered implant, the SIC Max. It's one kit for all 3 of those, right? So you don't have to stock different kits or worry about the assistant grab the right kit. It's all simple and it's easy. Right. Yeah. Yeah. It's a great mindset to bring to any business and especially one that trends towards complexity the way that implantology can, and
it's an aspect which is probably the most important to the clinician,
right?
Not for somebody who maybe does 2 or 3 implants a month,
right?
But somebody who works professionally and efficiently and really tries to cater to the demands of the patient today with all those crazy things, immediate loading, and patients want to come with pictures with their role models, right? Onto the chair and says,
yeah, I want that movie star smile. Yeah. Whether or not the biology is accommodating of it, right? Yeah. No, it's a great mindset to have. And yeah, it's easy, when you're a bigger company to acquire other companies, you can throw your money around and kind of hodgepodge together a product portfolio. But I think if I rephrase what you're saying, following that path leads to a product portfolio that isn't really cohesive and doesn't really have synergy, right? But when you develop everything yourselves in-house, you can make sure that the next, when you've completed the ACE, which was your first implant, and you move on to the Max, that everything that was used for the ACE can work for the Max, and you have that kind of control.
Absolutely.
Right. Whereas if you just, here's a company that makes a maxilla implant, we'll just buy them. Right. Now, whatever they have, probably won't work in harmony with what you've already established. And that's where things get complicated. Right.
And it's not only for the surgeon, it's for the entire ecosystem of a dental office.
Yeah.
I mean, nobody wants to learn and to learn a new system or to have few trays to clean and this and that and to prepare. Simplicity is king here, and SIC invent with the SIC system and the architecture is pleasing everybody, the whole team.
Yeah.
Yeah. Oh, it's a big part. I know I speak quite long about it, but it's a very important part of the success story of SIC.
Yeah.
It is.
We can tell it's core. It's core to your business, and it's important to have, those types of things at your foundation. Right. Let's go back to the Schilli implantology circle, because, you likened it to, I think you said ITI. Yeah. And my understanding of it is it is a group of individuals, right? A group of professionals, a group of I'm sure it's maybe it's a variety of different specialties or variety of different people. But like, how do you find them? How many people are in this circle? How do they inform your decisions as a CEO of this implant company? Unpack that for us. If I wanted to be a member of the Schilli implantology circle, how would I go about that?
You first have to go and have a nice beer with me.
Okay. Well, I think we've already done that.
Okay. All right. Sure. So you passed it first. Okay. I mean, it's the circle is really one, like the architecture we discussed before is also driven by the circle. Yeah. Okay. Everything is driven by the circle. So the circle is a group of doctors. We started with the founding members of the circle was Professor Feutzi, an old ITI fellow. It was Professor Bookbinder from Mount Sinai, U.S. Even though we didn't start in the U.S., so now it's 20 years later that we come to this market. But he influenced us with his professionalism, with his tremendous talent to organize focus groups and work to efficiently for development and bringing things to the market quickly. He's amazing. So and he's also stepping in where my father, when I founded the company little over 20 years ago, my father was already over 75. So he was a big help. But I had to look for people who would step in when he's gone.
Sure.
And Bookbinder was one of the key people. And through him, we really had always contact to American colleagues. But besides that, the core, since everything started in Switzerland and Germany, the core 30 doctors are from that area. And this is something I also learned from my father, is that and he was a maxillofacial surgeon, and this is GPs or dentists and maxillofacial surgeons is a very different. They're very different kind of people.
Yeah.
And he was always, and that was very appreciated by the dental community, by the dentist community. He was always also very much a dentist. So he said, George, what you need is practitioners in there, and you need dental laboratory people. You need dental nurses. You need all the players who make the successful team. You need in that circle. And today we are a little below 100 members. We have the fellows and the members. With ITI, it's the other way around. So our member is the highest with what we have, and we are here already at with that markets we had, and that's the market is Central Europe, is Middle East, is China, is Southeast Asia, Australia. With these 100, we are very effective. And now we move on into the US market, which all those markets are very different. And that's also why you need to really cover all the markets. You need to have a certain ambassador, a certain representative to bring in what's needed. And I'm looking now very much forward to organize the circle basically the American chapter.
Yeah.
And this is going to be a very important part of the success. We meet yearly in an international meeting, and we meet during the year in so-called task force meetings.
Okay.
We have a surgical task force meeting. We have a pros task force meeting. We have of course, digital dentistry task force meeting.
Of course.
And that's where we work. Once a year we meet, we present what we have done during the year, and then those groups keep on working on a project, or we have a new project, and we mix it has to be possible geographically to mix those people to get the most out of it, and not to overdo it with having people from too far away. But we built those groups, and they basically give us the input for the product. When the product is prototype and if first series is produced, they do the clinical observation. And that clinical observation, we are quite a bit conservative here, maybe. It takes a little time sometimes. But when everything is okay, then we launch it to the market. We had never had one product recall in 20 years.
Wow. And that speaks volumes to this process, right? So this circle of, I think you said a little less than 100 professionals, everywhere from lab technicians to assistants to, general dentists, prosthodontists, run the gambit. They kind of give you feedback and say, hey, if this is what SIC could provide us next, this would be valuable to us, right? You work with your team of engineers on it, you produce prototypes, you hand it back to them and say, okay, it's on, this is what you asked for.
Yeah.
Right. Let us know how it is, right? They run it through the gambit themselves, collect feedback information. Maybe you improve the product. You might go through several rounds of that, right? Before a product is fully refined.
Yeah. Yeah.
And then once that process is done, only then can it be released to the market.
And Neil, and we live it.
Yeah.
We live it. It's not blah, blah.
Yeah.
We live it.
Yeah. Yeah. That's, for me, that inspires a tremendous amount of confidence in these products, that type of thorough vetting and improving and optimizing. I don't think it should be anything less for something that is going to be implanted in a patient's bone for decades.
Yeah.
Yeah.
It's like, as a company of a medium-sized company, we have family owned. We have a couple of shareholders, of course.
Mm-hmm.
We have to really look out where we put our money.
Mm-hmm.
Watch out where we put our money. And we have certain, when we talk about the Schilli Implantology Circle and scientific background we have in the product, we have selected a few universities, mainly in Europe. It's our history.
Sure.
Who receive grants from us, of course, on a yearly basis, and they have assistant doctors and so on working with us on projects, but also even we support not only very super focused. It doesn't have to be always focused only on our product. We support them in other investigations.
Okay.
This is something where we source a lot of young talent also for the circle, and people who really appreciate working with us. So this is the part of the university part, the classical part, and it gets harder and harder because of the ethical rules and guidelines you have to follow up.
Yeah,
you have to follow. But this is an important part. But the other important part for working and receiving sound scientific data and sound product feedback is the clinician, the general practitioner out there, and to organize those is sometimes a little harder. Also, my father, I have to think of you, dear Wilfried. He always told me when he was the dean of Freiburg University, that was the largest university hospital in Germany before the reunification.
Mm-hmm.
And he always said, we try so hard. We give them so many opportunities to hand in scientific papers and this and this and that. At the end of the day, of 100, we can only use 5 because protocol is not followed. That the follow-ups are not in. Then important diagnostic information is missing, and so on and so on. Yeah. So really receiving good material, which you can then at the end publish in the highest ranking journals worldwide. Right. What we want to do, what we do, is tough. Yeah. So, I think we are from a perspective when you look into the landscape of premium implant companies today. There's probably premium. I would call there's probably 15 out there worldwide. Yeah, we belong surely to the ones besides the ones which are there, Nobel Biocare and Straumann, which are there for 50 years, 60 years. Right. We belong to the ones who have the most sound and decent material published.
Yeah. And publishing that, I can almost understand why, like your father said, maybe 95% of these studies can't be used, because if you're going to put it in the most prestigious publication, it's going to be picked apart by some of the most, the smartest individuals out there, and it needs to be able to stand up to that rigorous review.
That's right.
On these studies, like what type of studies do you have going on perhaps now? What have you done in the past? What type of data or information is a business like yours hoping to get from universities?
I mean, a company like us, whatever size, small or bigger, they always have to look out what they do, of course, in order not to kill their own business. Yeah. So you don't want to investigate things which at the end of the day, turn out to be, that the USP is gone or whatever, or Right. So what we did, I think that one is a very important one, and shows also that we are very frank and honest with what we do. Is we were one of the first implants which were really platform switched, 2005. I think an American company, 3i, was there, and Straumann had nothing in the market. 3i. We were with 3i probably one of the first ones, and we said, let's compare the SICAs, that was the first generation of our implants. Let's compare a platform switched implant with a non-platform switched implant in a long-term study.
Okay.
That has never been done. And we did it that we basically took our platform switched SICAs implant and manufactured the same implant, non-platform switched.
Oh, okay.
And then did a split mouth surgery, and we followed up on the development, and that was done by the University of Bern, and by the University of Freiburg. And the outcome at the end of the day was not what we wanted to see.
Really?
It was that basically both implants performed almost the same. Interesting here is also is then to understand that one factor, one attribute of a product is not deciding if it's good or not. It's the whole thing. So both the results were very, very good. But why were they very good? Because of all the other factors, they were the same in both implants. Surface, interface, all that was the same. And it seems like the combination of what we have, what we provide with our technology, with our system, the surface, the macrostructure of the implant, if platform switched or not,
right.
The interface is giving this excellent results. And there's also, a platform switched implant has not only advantages or supposed to have advantages in longevity, but it's that the practicability for the prosthodontist is when he inclinates the cross part, that the reduced size of the cross part is easier to inclinate. That's all those ideas. But that was one very interesting study. and it's now in the 20th year, I believe, almost, and we always follow up. That's one super interesting investigation. We have many more going on, of course, with hybrid constructions with different materials. It would be too long to mention them.
Yeah.
For the next time, maybe the next one.
Sure. So you said it's going on 20 years now. Are these, patients that have the implants that come back once a year for analysis and review? Or I heard a colleague of yours mention there's some sort of system that simulates chewing cycles. Is it usually one or the other? Is it often a combination of both? Like,
yeah, I mean, it depends on if it's in vitro or in vivo,
right?
But here it's on patients, so they have to come back. Okay. The cycles we spoke a couple of days ago. The presentation we heard, that's a different story. That's done with chewing machines. So they work and come when you want, And here, this study is done at the University of Bern, the University of Freiburg, and they have they have a patient base which is quite loyal, and that's also why we chose these. It's an area geographically where people don't move so much, so we see a lot of they come back and they come back, and not all of them. And some passed away, of course.
Sure,
but that's how we keep track.
Yeah. Nice. That's some, intriguing stuff. And it sounds like even when you don't get the information that you were hoping to get, you still get information that allows you to make your products better. And of course, that's really what it's all about.
Yeah.
Yeah. So I wanted to get back to kind of how I introduced your company at the beginning of the podcast. Of one of the greatest kind of German Swiss implant manufacturers that perhaps our listeners hasn't heard of. And help us understand why is it that SIC Invent really hasn't developed a footprint in the U.S. market yet, and I might upset our marketing folks, but maybe we can give our listeners a bit of inside information about how Imagine and SIC are going to be working together. But 20 years in business and not much in the U.S. yet. How did that come to be, and why change that now?
I wish I could have changed it earlier. It's when you start doing your journey and you come to a path, to a crossroad, and you have to decide where you go. You go the way where you believe that it's easier. Down that way where you believe it's easier.
Right.
To go down.
Or it makes sense.
And we also expanded and grew by opportunity, and a very optimistic growth. And that's we started in our heritage market. And by the way, that's what I like very much. I like Imagine being from Virginia, New Hampshire, and California. And SIC Invent being basically from Switzerland, Germany, and Austria. I think that's a very nice fit, by the way.
Yeah.
No, we developed, of course, and that's when you're not successful in your home turf, forget it.
Right.
So everything sound scientific comes from that German-speaking Europe region, which is the biggest dental market in Europe.
I see.
Period.
Yeah.
Germany is the biggest market still. Maybe by volume, there's Spain at the same level, but Germany, I believe it's still the biggest. So we developed those markets, and we had the opportunity in 2009, 2007 or 2009. We had the opportunity we were approached by Synthes, by the company Synthes, to go west, to go to the US.
Right.
And everything was basically in safe shoes. But then Synthes got acquired by Johnson & Johnson.
Right.
And then it was to create Synthes, Johnson & Johnson.
Yep.
and then they decided not going into dental. And that was our first setback with the US market.
You see.
And parallel, we had the opportunity with some Synthes distributors. Interesting, because Synthes is craniomaxillofacial.
Right.
Yeah.
Right.
And the Chinese Synthes distributor was very interested in doing something with us. That's how we kicked off China.
I see.
That's how we kicked off Thailand. And that's also how we kicked off Taiwan. And that's how those markets really then, they grew.
Right.
They grew.
Yeah.
And imagine we are a company only a couple of years old. To cover those markets, I had to focus. I had to take that decision. And with Synthes in 2009, I would have done the US because Synthes would have, first of all, financed it. But money is not always everything here. They would have had the infrastructure to do that.
Right.
And that was really, that's a shame it didn't happen. And after that, we had a couple of opportunities where I said, we were approached many times for the US, but we said no. And that brings us basically to you, Neil, and to Imagine.
Yeah.
And what I see there is a tremendous opportunity.
Well, we appreciate that. And it's the same thing could be echoed from our side. We've had several implant manufacturers approach our company wanting Imagine to offer their implants. And, like you said, it at the end of the day, none of them were the right fit, right? We didn't have common vision. We didn't have, a good rapport, a good synergy, right, between our companies. And to put a fine point on it, starting very soon, I think, perhaps in Q4 of 2024, everybody's going to hear about a partnership between SIC and Imagine, but, you all heard it here first on the Digital Dental Podcast, which we're tremendously excited about. Speaking of digital dentistry, this is the Digital Dental Podcast, and Imagine is a company 100% invested in digital dentistry. For your business, having started at a time when, CAD/CAM digital dentistry was very much in its infancy. I mean, yes, the real infancy goes all the way back to the mid 80s, but in 2000, 2003, 2005, intraoral scanning, 3D printing, and 5-axis machining for the dental industry were not nearly as ubiquitous as they're coming to be today. And throughout that journey, right, from 2003 to today, how has, the proliferation of digital dentistry kind of changed how you guys do business? Is it, does it impact the design of an implant at all? How has it kind of impacted us?
I have to say, Neil, if you want to do a good job or a better job than the others, you have to focus on what you are best at.
Mm-hmm.
And we have not picked up, providing scanners and printers and so on.
And a lot of your competitors have.
They have, and they have changed their suppliers and partners many times. Yeah. And also the three leading companies in the world, it was not always the home run. Yeah.
Mm-hmm.
And we saw that, and we focus on what we are best at. And that's implants and prosthetics. We were very early with the approach of guided. Mm-hmm. We saw that, and we are very good in that. We have great solutions. And we understood that we have to adapt to the digitalization of the process.
Yeah.
And here we said we are open. So libraries, you find us everywhere.
Yeah.
So you can use your equipment at home, whatever you have. Mm-hmm. At home you might not have it.
But some people have glass in their homes. I've seen it.
You can use it. Most of it is integrated in our workflow, and that's how we followed up and stayed on track with the digitalization of the whole therapeutical pathway.
Yeah,
and I think I know which question comes next from your side.
Oh,
So
okay.
I'm trying to answer it. Maybe if you have another one for me, then I'm there. I do that now because otherwise I probably forget. Because it's so important. You asked me why America, why now, and why Imagine,
Sure.
digitalization and all that. And I said, yes, focus on what you're best at,
Right.
but understand what's around you. Don't walk through life like this.
Right.
Yes,
With the blinders on.
So Imagine has done a tremendous job on that, in that digital field.
Right.
And for us, it was now, this is a very important decision we make here. We are again at one of those crossroads.
Right.
Do we go right and believe that we can do everything ourselves? Invest in a CAD/CAM center, in a milling center. Maybe partner with some Korean digital company for scanners and so on. Do all that and have a closed system, or do we believe that it's better to go with somebody who brings the expertise from day one, because we don't want to make mistakes and we don't want to lose that train, and that's why we took the left turn, and that's why we're taking the left turn, and what we see. And that's the experience I can tell you, and we will see that in the US too. And that's what we see in the Asian markets. We're one of the few companies, by the way, have a direct subsidiary in Korea. There's only Strawman and us is left. Denspa is reopening, I heard. But everything else is dominated by local companies. We've been quite successful in Korea, and we get it's an incubator for us. To adapt, to have the right products for the Asian market. It's where I see when you look into what's happening in these markets, we, and not only SIC invent, but all the other premium companies, we start selling less and less prosthetic components. It's going down dramatically. And what we have seen, by the way, we had for our teams here today, we had a very nice presentation regarding quality. What you see, and we look at everything what's in the market, copycats. What you see in quality copycats, the bad quality copycats, and the restorations, which are then combined with our implants, and we cannot avoid that.
Right.
That's frightening. That's frustrating. But we cannot avoid this. We cannot turn around that trend.
Right.
So my decision is, let's go with people I have trust, which people with a track record, people who know what they're doing. And then for us, it's a big step. You have to understand, we give away most of our prosthetic revenue.
Right.
We give it to Imagine.
Right.
Yeah. But I believe that together we are stronger than by trying and holding too tight to that old fashioned way of providing products. And if there's copies, then let's do it together. It's not a copy. It will be a solution together.
Exactly.
And Imagine works as we do, streamlined, simplified, fast, and safe.
Yeah.
And that's what turned me to you.
Yeah.
Clearly.
And that confidence means the world to us and really invigorates us to, to really, not that we wouldn't otherwise, but put our best foot forward, and really do something really exciting here. And I give you and your whole company a lot of credit for that idea of focusing on what you're best at, focusing on your core, right? Because a lot of your competitors have been distracted by the enticing opportunities. We can sell scanners, we can sell, custom abutments and blanks and tie bases, we do all this other stuff, right? I do believe to the extent you do that, you take your eye off of your core, right? Which should be, engineering, developing, designing, manufacturing great implant.
Yeah.
That's the core.
Yeah.
Right. And, I've seen this trend developing, and it's no surprise to me that, people look at, the $250 custom abutments from a big implant OEM and just like, such a price is nothing short of exorbitant,
Yeah.
So why do that when from a good, qualified, vetted, trusted milling center partner, you can get something at a fraction of that price that fits wonderfully and restores beautifully,
Yeah.
Why not? So
restored on a premium implant.
Yeah.
Which you don't, that one is there.
Mhm.
It stays there, hopefully
yes.
a whole lifetime.
Yeah.
The prosthetic restoration can be adapted and sometimes has to.
Mm-hmm.
No, it fits. We have a very good fit here.
Yeah. And yeah, I agree. It's very exciting, right? Lots of great stuff to do. Looking ahead, we're kind of talking about the future a little bit here, the future of SIC and Imagine. But I happen to know, and I don't know to what extent you can talk about them at all, but you have some future things that you're developing for SIC Invent, maybe an app of some sort to help with guided surgery, and perhaps another implant to follow up a fourth model, ACE, tapered, Max, and something else. Are you able to share any of that with our listeners?
Yeah, I'm able to share some of this. If we speak about digitalization, you have, of course, you have two different customer groups. You have the established dentist with his office, with an established clientele, and they probably go more. Yeah, why should they change? They're looking into digital. They're looking into modern solutions, but basically they have their protocol. And they follow their protocol, and they don't see a reason to change that. So for those, we do have the traditional guided surgery kit. We have the traditional path of doing that, and we provide the service, the after service. That's what we have. But today you see more and more that people are looking for tech. They're more techies in the among the dentists and younger people.
Yes.
And if you go to trade shows, what's new implant? Yeah, interesting. Okay, but you look at it and you move on.
Right.
Yeah. So what a lot of companies are trying to do is generating a certain buzz with technology solutions.
Right.
And one example is Navident. Now, and Navident is basically have you heard of it?
No, I
know.
No.
Okay,
Yeah.
It's a solution. I mean, brain surgery in many other surgical fields where you have limited access to the surgical field.
Mm-hmm.
You go through a camera, and you operate basically over a screen.
Right.
Yeah. So, and that's something which is discussed for the last 20 years in our industry as well, but somehow we have never managed to do that. So there is one solution on the market, and that one creates a lot of buzz, but it is quite cost intensive. And really to change your workflow to this is only, that's for people who will be working for the next 30 or 40 years.
Right.
Yeah. It's a younger generation. And what we did is and basically they all work with guides. They all at the end of the day have the traditional guide made. Mm-hmm. You have your 3-dimensional picture made, then you have your software, whatever you use to plan your case, and you have the guides printed, and then you proceed with your surgery.
Sure.
What we have developed together with a couple of universities, we I cannot mention now because we haven't disclosed everything yet, and we will soon, is basically the first AR AI solution in guided surgery. Really? The difference is everything stays the same, but at the end of the day, you have no guide. Don't need the guide anymore.
Really?
And on top of that, you don't have no need for a guide. You basically, I lost it now a bit. You have no guide. Yes, you have no tracker. And that's with Navident, for example, you have always a tracker to know where you are in the mouth in order to relate to the instruments or whatever you have.
And is this tracker, kind of
it's fixed in the mouth? And we don't have that. So the system works basically AI based and connects the handpiece with the planned case and with the information you have from the patient. And it shows you on the display through a camera. It shows you exactly where you are in the mouth. And shows you we have a little cockpit developed, green, red, where you are, depth, and so on. And that's the most advanced solution there is. We had focus groups, we had testing groups with students and so on. They love it. There's one problem, regulatory-wise, it's probably a path to go. But what we already offer to certain closed groups is, and where it gets a great response, a great feedback, is in training people to do implants.
Right.
Yeah.
And you get that immediate feedback.
You get the immediate feedback.
Right.
And you can you can display it, and you can compare, how accurate you are and so on. And that also can be used to educate patients. So we're working right now on basically on a cockpit, how you can educate the patient how precise you can plan the case and execute the case.
Right.
And that's integrated in this SIC Navigate AI Navigate project.
Wow.
So super exciting, high tech, and we will probably have it on in our booth for IDS.
Okay.
And
I look forward to checking it out.
Yeah.
I mean, it's a great solution because, everybody conceptually likes the idea of guided surgery, right? It allows a level of predictability from the restorative standpoint, right? You can have, custom abutment and a provisional ready to go. But a lot of doctors don't like having a big bulky guide obstructing their view, maybe inhibiting irrigation. There's a variety of reasons why a guide from just the physical object standpoint really isn't that great. We like what it does, but maybe we don't like what it is. Some have tried to get around that with 3D printed metal guides that are comparatively smaller and offer more room for visibility and cooling. But those are difficult to design and manufacture, so they're not accessible to everybody. So with something like this, I think it solves a lot of those problems while still allowing the digital workflow and all the benefits of it.
If you want to move forward, you have to move. In order to bring things forward, you have to look for new solutions.
Yeah.
And this is an exciting solution. And we are not telling people this is it,
Right.
And again, there might be many practitioners who say, "Ooh, I prefer that guide because it guides me also physically."
Right.
Yeah.
Right.
But there's people who say, "No, I can do it freehand, and I can control this over a display."
Yep.
So we leave the decision to the doctor, but we are right up front there, and we are one of the first companies who have such a solution.
Yeah.
And we will develop it further.
That sounds incredible. I can't wait to see it at IDS. So believe it or not, we're coming up here on the end of our time together here on the podcast, George. So I think what I'll do is I'll end our interview the way I like to end all of them, with one simple question. George, do you like going to the dentist?
I love going to the dentist.
Do you?
Yeah, I always fall asleep. It's true.
Do you really?
Yes.
Mostly
I choose the wrong day because the night before I have a dinner and maybe a glass of wine.
Yeah.
And I have a lot of things in my head. And then, the appointment is in the early morning. And I get there and I know I don't have any problem.
Yeah.
So I fall asleep.
Nice.
While there's dental hygienist is taking care of me.
Yeah. Hey, get a good nap then. Why not? I might give that a try next time I go for my cleaning. Well, Georg Schilli, SIC Invent, you've been a fantastic guest. Thank you for kicking off season 2 of the Digital Dental Podcast. And we really appreciate your time and look forward to talking to you much more in the future. All right.
What a fantastic podcast. What a fantastic atmosphere. Thank you so much.
It's my pleasure.
All right. Forward.
Yeah. We'll see you again next time. Thank you all for watching, for listening. And as always, happy CAD camming, everybody. We'll see you next time.